done, and let me tell you that I'm honored and humbled to be with Macady. It's been my experience with people that have a chronic health problem, and Macady's example of this is a lot of their journey and a lot of what's happening is on the inside. And they don't want to really bog people down or stress people out. And so what happens is they live on willpower, and you can ask them how you're feeling, and maybe the response is, "Oh, I feel fine," and inside they feel like they're dying. And so when we did the workup with Macady, she was nauseous, not feeling very well. The POTS syndrome that were going down, this chronic pain that she's developed, and maybe it was triggered with the surgery that she had at 14, or maybe it's those little hitchhikers that we have in our system. And what I mean by that is when we took an evaluation of her, we could see that there was some things inside of her blood cells, and then we confirmed, with the workup and the history in the labs that she's got a chronic viral problem. And if you took an extension cord and you plug it into people, it just sucks out all of their energy, and that's what was happening with Macady, is there's just no energy. And so she's basically manufacturing energy by stress and epinephrine, and that's where you get the POTS from, and that stands for postural orthostatic tachycardia syndrome, which means that anytime she gets in a stressful situation, what happens is her heart rate will just go up really, really, really high because the body is out of reserve. She can't manufacture adrenaline, and so we have these huge swings from normal to really high pulse rates, and guess what? No one feels good with a high pulse rate. And so what we're trying to do for her, and we've already seen some improvement, is balanced people don't get sick, they don't get symptoms. And so what happens is the body is trying to adapt. And the way that you help someone with her complicated condition is you got to balance everything. And so we're doing some vitamin infusions, we're doing some neural reset therapy, we're following a protocol in a book called Curing the Incurable, and we have really high expectations that we can get her normal. Now, I say that in parentheses because there's been some structural damage from the surgery and some other things, but definitely the energy, the brain focus, the pain, the aches and stuff that she's having, like all of those, we have really high expectations over the course of a 10-week treatment that will be significantly improved. So today we're just getting ready to start our treatment 3. She's a little bit ahead of schedule because she's really compliant. We're dumping in really high amounts of vitamin C, magnesium, potassium, selenium, calcium, all of those things to help build up the system. And then we're using a German technique called neural therapy, where we take a B vitamin, a little tiny syringe, and we inject the acupuncture nerve control points for the body where we want her nervous system to open, close, and reset. It's like rebooting the system. Because Macady's been sick for a long time, her nervous system's kind of forgot what it was like to be healthy. So if we balance her body, put building blocks in, and reset the nerves, we have really high expectations that she's going to beat her disease. I mean, we know 2 things for sure. One is that you're not your diagnosis, and 2, if we balance you, that good things are going to happen.
Yep. Which sounds really simple, but it has obviously taken Dr. West as a very unique doctor and brilliant man to figure it out. So he's been the first doctor so far that has offered this option to us, and most importantly, I think it's natural, so it's not just totally frying my body, which every other treatment I have done has done, and causes more damage in the long run and just covering it up. So I think it's a really cool experience. We're feeling hope for the first time in our life that, I won't be here for the rest of my life. As much as I love the West Clinic, like, he's giving me the tools to move on for the rest of my life. So we're really excited.
All right, you guys, we'll see you later.